Hi, my name's Melissa, and I'm an assistant psychologist at the private therapy clinic. Today I'll be discussing a little bit about a disorder called Orthorexia Nervosa in children and adolescents. So what is orthorexia? Orthorexia is an unhealthy obsession with clean and pure foods. People with orthorexia might have very specific specifications on the way they like their food prepared, or have very specific specifications on the way their fruits and vegetables have been cultivated, the different methods used to prepare these types of foods, as well as the micronutrient information on food packaging. People with orthorexia might try and avoid certain food groups or foods that have been treated with salt, sugar, artificial sweeteners, or contain an excess of saturated fats. As such, people with orthorexia might find it difficult when there is ambiguity surrounding the food that they're eating, where they're not entirely sure what's in it or how it's been made. So what are the signs and symptoms of orthorexia nervosa? These can include, but aren't limited to, the following: an obsession with a healthy diet, an increased focus on what you're eating, which may interfere with other areas of your life, feeling unable to put aside personal rules about what you can and can't eat, feelings of anxiety, guilt, or uncleanliness over eating food that you regard as unhealthy. Your emotional well-being is overly dependent on eating the right kinds of food. Low mood or depression, cutting out particular foods and food groups from your diet in an attempt to make your diet more healthy. Taking an existing theory about healthy eating and adapting it with additional beliefs of your own, which aren't necessarily backed by science or evidence-based research. Judgment about the eating habits of others, and interference in your relationships or work. In children, this can result in a significant impact in their school life. Orthorexia nervosa is not actually part of the DSM-5, which is short for the Diagnostic and Statistical Manual. If you are presenting with these symptoms, you might be diagnosed with a disorder called EDNOS, which is eating disorder not otherwise specified. This disorder can be diagnosed if you do not fit into the category of either anorexia nervosa, bulimia nervosa, binge eating disorder, pica, or other types of very specific types of eating disorders. Unlike other eating disorders such as bulimia or anorexia, orthorexia is not consumed by an extreme calorie restriction, but instead is very preoccupied with eating the purest or healthiest or cleanest foods possible. Their self-worth and self-esteem is aligned with meeting this goal. Body image distortion and the fear of gaining weight is not necessarily related to orthorexia, although there might be some overlap, such as the strive for perfection or the very strong need for control. That's not to say that orthorexia can't lead to weight loss as a result of the extreme selection of certain food groups and the complete exclusion of others. They might engage in fasts or stricter diets as a form of self-punishment if they've broken one of their food rules. They might also engage in these fasts as a means to purify or detoxify themselves. Orthorexia has also been conceptualized as an extension of obsessive-compulsive disorder. People with OCD are similarly preoccupied with obsessive thoughts and compulsive behaviors, such as checking things multiple times, excessive hand washing, cleaning, and a big fear of contamination. An individual with orthorexia experiences obsessive thoughts surrounding food and exerts a particular meticulousness surrounding food preparation and the cleanliness of their food. Meal preparation can also become a ritual as a means to avoid contamination. Whilst you can't technically be diagnosed with orthorexia nervosa, there are a number of scales that have been developed by researchers. Bratman's orthorexia test, the Ortho-15, eating habits questionnaire, the Dusseldorf orthorexia scale, and the Barcelona orthorexia scale. A large study found that individuals aged 13 to 16 present the largest risk of developing orthorexia, and multiple research studies have found orthorexia to be very frequent in adolescents. So why is this? Adolescence is a very challenging time for someone's nutrition, as you might be more susceptible to negative body image, weight pressures, and disordered eating behaviors. These can be associated with different types of malnutrition, such as undernutrition, obesity, or not meeting certain nutrients that are required at this age. In addition, adolescence is a key time for people to develop eating habits that will likely last a lifetime. So what can cause orthorexia in children or adolescents, or even beyond this? Numerous factors can be involved in developing an eating disorder in adolescence. This can be a result of a combination of biological and environmental factors. One factor, however, has undoubtedly been found to be significant in the development of orthorexia, and that is social media. Social media has become a vital part of not only children and adolescents' lives, but the majority of adults as well. Studies have shown that frequent social media use can have a detrimental impact on one's mental well-being and can even lead to the development of depression, body dissatisfaction, and eating disorders. One of the platforms which has been found to have a significant impact on the development of orthorexia is Instagram. They found that the healthy eating community on Instagram showed a higher prevalence of Orthorexia Nervosa, and that a higher usage of Instagram led to increased symptoms of orthorexia as opposed to other social networks. The reason for this could be due to a large number of users with big followings, namely influencers, who promote their healthy lifestyle. They share their healthy eating habits, which namely have a preference for fruits, vegetables, the avoidance of alcohol, avoiding processed foods, and shopping at only organic stores. When children or adolescents consume this content, they may not be able to draw the line between disordered eating and healthy eating. Their parents may also not be able to limit their exposure to this type of content, or even other more problematic accounts promoting eating disordered behavior, such as the pro-Mia and the pro-Anna accounts. So when should you be concerned as a parent? Is your child's healthy eating starting to directly affect their weight, growth, or physical development, their physical health and well-being, their emotional well-being, their ability to participate in social situations, or your life as a family in a way that is causing significant stress or distress? For example, this can be a heightened stress during family meal times. So what can you do as a parent as a result of this? It is recommended to learn as much as you can about eating disorders so you understand what it is that you're dealing with. Keep telling your child that you love them and that you will always be there for them. Suggest activities that they can do that don't involve food, such as hanging out with friends or family. Ask them what it is that you can do to help. Pick your battles around meal times and keep the stress low. And most importantly, seek help if you are concerned about their emotional and physical well-being. Since orthorexia is not an official diagnostic category, there are no evidence-based treatments or recommendations for therapies. A full assessment needs to be conducted to determine whether other elements of other eating disorders are present, such as anorexia and bulimia, or even to see if components of OCD are present. Treatment for child and adolescent disorders often requires a multidisciplinary approach from a psychiatrist, therapist, and a dietitian. The recommended psychotherapies for general eating disorders are family therapy and cognitive behavioral therapy. If OCD is present, then exposure and response prevention will be recommended, as this is the gold standard treatment for OCD. Enhanced cognitive behavioral therapy is an evidence-based treatment for treating eating disorders. It aims to reduce the risk of physical health and any other symptoms caused by the eating disorders. It consists of 4 stages. Phase 1 involves introducing regular eating back into your life. This can involve weighing sessions and completing a food diary each week to monitor your eating habits. Your therapist can provide psychoeducation, promoting the consumption of a variety of food groups. You'll understand that the quality of food consumed is not the only factor determining health, and learn to eat without falling into an obsession. The second stage involves working towards regular eating and understanding the links between your thoughts, emotions, and behaviors. You'll start to work on changing these negative thoughts and problematic behaviors, and you'll also review your progress so far throughout therapy. Phase 3 is where you can start to address the interpersonal problems caused by the eating habits, perfectionism, low self-esteem, and the extreme dietary restraint. You'll also start to learn skills to deal with day-to-day events surrounding eating, such as dinner parties or just general meal times. Finally, stage 4, you'll start to think about the changes that you've already made and how to keep well in the future. You'll also learn how to deal with any setbacks. Family involvement is generally an essential part of enhanced cognitive behavioural therapy for children or adolescents. Your parents will likely have a session of their own and join the final sessions of therapy to see how they can best support you. Thank you so much for watching this video, and I hope it was helpful. Recovery from an eating disorder is definitely possible, and it's very important for us to intervene as early as possible. Research looking into any disorder has found that early intervention is key in making sure that the eating disorder doesn't progress into riskier situations, such as a detriment to your physical health. If you enjoyed this video, please like the video and subscribe if you'd like to follow more content like this. Thank you.